Social workers being present in the clinic brings resources for patients that medical providers might not always know about. So integrative health gives the patient everything they need under one roof: mental health, dental, counseling, medical care, pharmacy services.
Our goal with integrated care has been the right care, the right place at the right time. And what that's meant is doing something kind of unconventional, taking a clinical social worker and putting her in the middle of a pediatrics unit.
All my kids' healthcare needs are met on every level. The dentist knows the doctor knows the therapist. Everybody knows everybody here, and everybody can work together as a group to complete the healthcare.
Social workers are able to discuss patients with other team members and together develop a treatment plan that not only includes their biological needs, but their psychological and their social needs as well.
You know, they might have diabetes, they may have high blood pressure issues, they may have PTSD and deal with anxiety. From a social worker standpoint, they're going to want to look at all the behavioral issues. Like if they've been working with Sally on managing her diabetes and making sure that she's taking her medication, have you been following up? Have you been getting the resources that you need there?
We do crisis interventions, wellness. We do a lot of different screenings for people: depression, substance use, anxiety screeners. We do those for children as well. Advocacy, sometimes people do need outside referrals such as food. They may need a referral for clothing or rent or lights or information. Yes, it can get busy.
It's quick, brief interventions, and it's very fast-paced. The social worker is probably going to touch base with 5 to 8 patients just in the morning alone.
I'll do therapy, and then I might go into the exam room and interact, or I might be holding a kid's hand while they're going through a dental procedure, or I might get called to the lobby because somebody is experiencing psychosis and nobody knows how to talk to them, to help de-escalate the situation. And I like that. I like the flexibility of getting to do more than therapy.
We see all ages. We see expecting moms. We have preemies. So we see individuals and families, and we have a geriatric population that comes here to manage their conditions. They might have diabetes, they may have high blood pressure issues, they may have PTSD and deal with anxiety. So we see all ages and stages, and we see all kinds of conditions, as across the board.
One of the biggest things is that they're here. They're physically here, and if you tell someone to call or to go see someone or schedule an appointment, the chances that they're going to show up are pretty slim. Whereas if they're here and you say, is it all right with you if I have someone come talk to you right now about it, they're much more likely to follow through.
I like to think the way we approach it, it's another member of the team. I have somebody who I work with who's really good at helping with hypertension. Hang on, she'll be right in.
I've never had anyone kick me out of the exam room and say, I don't want to talk to you. Once I come in, I say, hey, I'm a part of your treatment team and I'm here to talk to you. You have scored high, for example, on anxiety. Let's talk about that and how could I be of assistance to you?
She helps because she's like a mediator sometimes. Like if you're not quite connecting with your doctor, or just the communication's not there, she'll step in and she'll kind of say, I'm kind of concerned about this, and she is too, and she'll just kind of like help you with that to get it moving.
We want our behavioral health providers, our integrated care providers, to help us transform the culture. Because often when you need a therapist, you don't need them in 2 weeks. When you can get in, or if you can get in, you kind of need them today. In our case, we've got a social worker who's helping an entire healthcare team think through how we bring resources to parents, right? It's about as normal as it can be. And she's going to help you in ways that the pediatricians maybe aren't equipped, or they're better suited to do other things.
I work here because of the patients. The patients that come here are so appreciative of everything that we offer them. And I love the fact that we are able to connect them to resources, and that we're able to get medical, and dental, and pharmacy, and their behavioral health needs met all in the same place.
It's about giving people a new way to think and new tools with which to cope. and maybe they can start doing things in the world that make them happy.
I feel like in the integrated care field, I'm able to help people that I may not be able to reach in other ways. And I just feel blessed to be able to connect with them and help them and kind of break that stigma of mental health.
And I think at the end of the day, it's getting to see your patients overcome obstacles, live a healthy quality of life, and be able to enjoy their families to the best of their ability. That's rewarding to me.